Hello and welcome back to my channel. My name's Kris, I'm an Australian GP, and today I'm going to be walking you through what it means to have and get a mental health care plan with your GP. Mental health is one of those taboo subjects, and whilst I'm really happy to see that as a society, we are becoming more and more accepting of those who have mental health conditions and more accepting of mental health conditions as they are, I do think that there is still a lot of stigma around what to do if you've identified you do need help and where to find help. It's very common to hear things like, if you think you need help with your mental health, reach out, there's help out there. But when you're mentally unwell, let alone physically unwell as well, it can be really hard to seek help and to accept help. And sometimes it's really hard to even know where to start. God, it's hard even when you're well, let alone when you're unwell. And that's what I'm here for, to kind of break it down for you. There certainly are several phone lines that you can call, Beyond Blue, Lifeline to name a few. And quite often I know that at the end of the consultation on the phone, or the chat if you want to call it that, they will often say, why don't you go chat to your GP and get a mental health care plan? So that's kind of the stuff I'm going to be talking about. As general practitioners, we are well equipped to listen to your stories, to make diagnoses and to commence or continue treatments, which may include therapies and medication. For some general practitioners with an interest in mental health, this means that they may actually fill the role as your therapist and do a lot of the psychological work with you. For most of us who aren't that way inclined, what we will do then is refer you on to a psychologist, a social worker with mental health training, or another mental health professional such as a counsellor to take over the therapy side of things. For the sake of this video, I may just refer to everyone as psychologists, but please be aware that psychology is not the only valid way to receive therapy. Like I mentioned before, there are people such as social workers with mental health training who are exceptional and an absolute benefit to people's journeys. As the name suggests, a mental health care plan is a plan to care for your mental health. And what it involves is a chat with the general practitioner about your signs, symptoms, and severity. We then try and formulate a diagnosis to then better give us an idea of the best way to treat you. With mental health, there's no definitive test like a blood test or a scan that shows exactly what's going on and how severe things are. But what we can do is use really good quality questionnaires such as the K10 or the DAS-21 to assess your severity. The way I explain this to patients is this gives us a snapshot of you right now in time, and in the future we can do another one and compare. And if we're seeing improvements, fantastic. If we're not, then we need to review, is the therapy we're doing the right one for you? Is the medication, if you're on medication, the right one for you at the right dose? Or are we missing something in your diagnosis? During your mental health care plan, your GP may discuss or even initiate medications for you. This will really depend on your particular case, your history, where you're at, so don't expect to walk out with medications, but do expect to potentially have that conversation. There is a lot of paperwork that we do kind of behind the scenes as general practitioners, and once the care plan paperwork is completed, this allows the patient to then access the first 6 sessions under the care plan with the psychologist or mental health care worker of their choice. These 6 sessions, depending on where you go, may be bulk billed, which means there's no out-of-pocket cost for you, or they may be significantly subsidized, which means that they are cheaper for you out of pocket than if you were referred without a care plan or you went without a referral at all. After your first session, the psychologist or the counselor or whomever will then write back to the general practitioner and say, we've had a meeting, we've got a plan, this is what we're going to do, and then they will write to us after the 6th session. This is because Medicare wants us to review around the halfway point, 5 or 6 sessions, to see if you actually need the next 4 sessions. In total at the moment, a mental health care plan allows you to access up to 10 sessions under the care plan. However, like I said, they do want that midpoint review. If I get that letter and the psychologist or whomever states that, yep, you would definitely benefit from continuing to see them, then I will get you in, see how you're doing, and then I will write another letter back acknowledging that I've reviewed and accepting that you are able to access the next 4 sessions. Due to the pandemic, there is actually another 10 sessions that patients can access. However, it depends on where you are and may be very different by the time this video comes up because it does change on a dime. Just know that on average, 10 sessions is the maximum, but because of COVID, there may be up to 20 sessions that you can access. These sessions are available in a calendar year, and being out of sessions doesn't mean that you're not able to continue speaking to your therapist, whoever it may be. It just means that you won't be able to access the subsidized or bulk billed rates under the care plan from there on. After the first 6 weeks to 3 months, depending on where you are in your situation, Medicare asks that we review your care plan to ensure that everything is going well. We can then review that care plan every 6 monthly, but of course, if it's every calendar year, you can access sessions. Most people have a care plan and at least 1 or 2 reviews, and then they get a renewal of their care plan in the next calendar year. It is scary asking for help, but a mental health care plan and the consult to get one isn't scary. What it does is it allows you, the patient, and your team to come up with a collaborative approach that's centered on you and your specific needs to get you to a place where you want to be. It's not cookie cutter, there's not one size fits all. It really is based on your particular scenario, your symptoms, your situation, your severity, your everything. So yes, I do acknowledge and appreciate it is scary asking for help. It's terrifying, but it can be so useful and you will thank yourself when you do. As you can imagine, these consults do take time. So what I suggest is that you book in and let reception know that you're booking in for a mental health care plan, as most GPs will have either specific times or slots open for these consultations. And in most cases, we'll ask for a double session. Legally under Medicare, these sessions must be at least 20 minutes. So for my clinic, for example, that's a standard session, but for others that may be a double. And personally, because of the depth that we go into with the mental health care plan and how draining it can be for our patients, I do actually ask that patients book a double, which is 40 minutes with me, so that we can give your mental health the due diligence and the due care that it deserves, and that we can take it slow and that you don't feel rushed, because no one wants to feel rushed, especially when they're bearing their soul and talking about their mental health. And that is a mental health care plan in a nutshell. I hope you found this useful. If you did, let me know, like, subscribe, comment, all the YouTubey stuff. Let me know what you want from me next. And until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.